Hi, I'm Becca Gulotta, a researcher at Google. I'm presenting this work on behalf of my colleagues at Google Research and on behalf of our amazing external collaborators from Georgetown and the University of Michigan. This work is titled Infrastructure and Care, How Trans and Non-Binary People Meet Health and Well-Being Needs Through Technology. The first part of this work just involves describing the various ways in which trans and non-binary people experience technology-mediated harms. This is well documented in the prior literature. So, for example, you see on social media the reinforcement of transphobia and stigmatization, the ways in which digital systems sort of constrain or erase people's gender identities, and so on. In addition to the various harms described here, I also want to call out the last one in particular, that personal health tracking systems can reify harmful norms around what it means to be healthy or well for all people, but often for trans and non-binary people through their exclusion from these systems. Of course, personal health tracking can help support some people's needs as well. And the self-reflective practices that they enable are often described as a central part of the process of developing and understanding one's identity. So the question we ask in our work is, how can technology support and not undermine this process, in particular for trans and non-binary people? The two key research questions we sought to answer were, what sociotechnical experiences shape trans and non-binary adults' use of technology to meet health and well-being needs? And what sociotechnical conditions characterize the experiences of trans and non-binary adults as they track and manage aspects of their health and well-being? In order to investigate these questions, we conducted a mobile diary study, that is to say, a diary study that took place on people's mobile devices. In this work, we captured participant experiences with health and well-being technologies and the intersections of those experiences with aspects of gender identity, day-to-day moments related to health and well-being and how they relate to participants' trans and or non-binary identity, positive and negative technology experiences related to health and well-being, and the intersections with trans or non-binary identity, and people's wishes or hopes for the future of these technologies. We had 64 participants in the study across Mexico, the United States, and India. They range in age from 18 to 54. All of them identified as transgender and or non-binary adults who have experience keeping track of some aspect of their health and well-being for at least 6 months. These folks had a range of different gender identities. I'm sharing this chart here just to be illustrative of the types of demographic information collected and the types of diversity in our participant groups. I'll say, however, there's a lot more information about the participants in the paper itself. Also, an important note here is that participants could select all of the categories that they identified with, so the response totals can exceed participant totals. After collecting the data, we engaged in an open coding of the qualitative data, which in some cases included having the responses translated, and there were also quantitative findings from survey responses in the diary study. We extend several concepts to this work: infrastructures of care, that is to say, the meaningful dynamic relationships that reflect people and communities' health and well-being activities; infrastructuring, aka the practice of enacting and sustaining infrastructures, and the participatory co-production of knowledge. And then also precarity, so the unpredictability and uncertainty that surrounds people's various aspects of people's lives, including their livelihood, their ability to meet their basic needs, and so on. Of course, we're not the first folks to make this connection. People who are marginalized from formal health systems often construct DIY informational and care infrastructure to meet their needs within precarious conditions. I'm now going to do a very brief description of the findings. Again, there's just a ton more detail in the paper, and I hope at the live presentation to also share some video clips, but I'm excited to share these with you now. The first of these findings relates to infrastructure and care and self-reflective experiences. The participants describe engaging in self-reflection through personal and self-tracking, in part as it related to having touch points for phases of their gender transition. Please note that we do not in any way endorse the view or viewed gender transition as like a linear process or some sort of standard process that one may experience. We're just here reflecting the experiences of some participants. For example, the person on the left who said, "I'm chronicling the changes that are happening in my body and in my mind and in my spirit." The second finding in this category relates to understanding and managing bodily responses to gender-affirming medical care. So, for example, a participant from India described that they'd started using a hormone tracking app, which they said helped them a lot to track their periods so they can prepare themselves mentally and physically for them. Additionally, these digital systems help people build the strength they need to face the impacts of marginalization. So a participant from the state of Mexico said, "Tracking my fitness was fundamental. It helped me to have enough physical and mental strength to face the changes." Additionally, these tools help people work around social exclusion. So a participant from India noting, "It's very difficult for people like us to know about how to manage your body well and not to be shy among the general public because, people in India especially are too judgmental about us and they belittle us." Second set of findings involve infrastructuring futures. That is to say, these technologies enable views of possible futures for oneself through the gender expression of others. So a gender fluid participant from Mexico City described how they sat down for a long time to investigate transgender and non-binary resources on the internet, but above all with YouTube testimonials, "I know people who lived through masculinization, and it was beautiful to find myself with so many perspectives, with so many cases, and with so many people happy for their change." Additionally, we saw how people infrastructure around marginalization. So technology was consistently used to establish and manage access to knowledge about gender transitions, informational resources to plan financial aspects of transitional care, and knowledge about and access to transgender and non-binary competent healthcare. The second set of findings relates to precarity, in particular, 3 different types: information precarity, thematic precarity, and access precarity. So much more detail about this in the paper, but here I'll just briefly describe each of them. Information precarity describes the ways in which people incurred harms through encountering, misinformation from sources on the internet, online, and as a part of their effort to understand their own well-being and health. So, for example, this participant on the left described how, when searching for information about their gender, they encountered many websites that described their gender as diseased and in need of treatment. Similarly, this participant here describes how, when they were looking and investigating the idea of wearing a binder and learning about their own gender fluid identity, they encountered fear-mongering talk about how binders will suffocate you, and that they'd not done further research, particularly from people who wear binders, they may never have unlearned past those misconceptions. Informatic precarity reflects how cis-normative, self-tracking, and well-being technologies can become sites of alienation, friction, and increased labor for trans, non-binary, and gender non-conforming people. The participants in our study described many emotional impacts of using these systems that cause harm by design. So, for example, the trans woman from India on the left here describes how it will actually hurt to choose from the binary gender options. And next, you'll see a clip from a non-binary person in the southeastern United States.
It relates to my well-being, I guess, also health, not physical health, but mental health, well-being, mental well-being, because it just further reiterates that society doesn't care and that companies don't care and that they're trying to invalidate the fact that I am non-binary. And female, male, no.
And finally, access precarity. Many participants described what we call access precarity, or the various costs of inclusion to access digital technologies. Access precarity includes material barriers such as insufficient financial resources to sustainably access technology or formal healthcare systems, and the emotional costs of accessing spaces that are unpredictably hostile. So in summary, our study underscores the urgency of designing technologies that reduce, rather than exacerbate, transgender and non-binary precarity. This precarity is a global condition. While politics shape the nuance and manifestation of transgender and non-binary precarity in different locales, our studies surface core themes that cut across those locales. These themes point to the need for a broader and multidisciplinary research agenda on designing for the inclusion of these people. Thank you.